I'm
Yes.
excited to be back.
All right, welcome everybody. Once again, this is Beyond the Steps. I am Melissa McDaniel with Turning Point Dance Creations, and we have Bree Zabrowski with Apollo Performance here again with us for season 2 of Beyond the Steps, where we tackle the issues that are happening and the topics that are happening in the dance world and kind of making sense of everything that we just don't have answers for. So we try to find the best, brightest, and most intelligent experts out there on a number of different topics. And today we have a bright, intelligent, and wonderful guest, Linda Bluestein, with us to talk about hypermobility and how we take care of our students living with hypermobility issues. First, I want to go ahead and give everybody our normal disclaimer. Since it is season 2 and one of our first episodes with the guest, you will see Bree and I going all over the place, here and there, typing, looking down. It's not that we are uninterested. It is that we're trying to get all of the feedback from everybody on every platform. We have Zoom, we have Instagram, and we have Facebook. So we're looking at comments, we're looking for questions. With that being said, if you have comments or questions, please put them in the chat. Just type them right in there and we will pull those out and give Linda a chance to answer those. So how do we take care of our students living with hypermobility issues? Now, I will go ahead and just be very honest and transparent and upfront. I've never even thought about hypermobility issues. As a dance teacher, as a dance educator, as a dancer, it's never even crossed my mind that there were disorders that were actually centered around hypermobility. We always knew, and Bree might agree, always knew people to be double jointed or super flexible, or, and I remember sitting around envying those people quite a bit. Never understand there might actually be some pain associated with their hypermobility. So now with contortion work and extreme flexibility skills being all the rage here on our competition stages and in our convention spaces, we really want to take the time to understand what the risks are of hypermobility and how we can support our students who may have hypermobility issues. So without further ado, let's go ahead and introduce Linda Bluestein.
Yes, so Dr. Bluestein is an integrative pain medicine physician and specialist in treating hypermobility disorders. In addition to her private medical practice, Hypermobility MD, she founded and co-hosts a podcast called Bendy Bodies with Hypermobility MD, which is awesome. I highly recommend that you add that to your must-watch every single week. Dr. Bluestein is a member of the board of directors for the Bridge Dance Project. Hello to our friends at BDP. We love you guys. That allergy and immunology, oh my goodness, working group for the International Consortium on EDS and HSD, the advisory board for Doctors for Dancers, which we love our friends over at D4D. Hi, Jennifer and team. And the resources committee for the Dance Healthy Alliance of Canada. You can find more information about Dr. Bluestein on her website at hypermobilitymd.com. And welcome, Dr. Bluestein. Thank you for being here.
Well, thank you so much for having me. I'm excited about all of this. Yeah.
Oh yeah. It's quite the production now, season 2. We've graduated. We're so happy to have you here because you are really an expert leading the charge especially in the dance community for hypermobility disorders. I definitely have students that have struggled with this in the past, and I still don't know nearly anything about it. And I definitely think there's a lot of stigmas about hypermobility that you can help us tackle today. But, let's start by asking, why do you feel like hypermobility is such a tricky thing for people to understand and a concept for them to grasp? Because I think there are a lot of misconceptions about it. Why do you think that is?
I think that it's because when we look at people and we see that they're more flexible, and we're used to knowing, especially as dancers, right? We know that everyone's body is different. And I think if you went into any studio and if you drew a line from here up and you kind of like maybe you record it and you block off people's heads, like you can probably identify your friends based on their body, right? We're used to looking at different bodies and making observations, but I don't think that most of us are used to thinking of those having the implications that they actually do.
Absolutely.
And so when Melissa was talking, I was kind of giving a chuckle because when I was in college and I was pre-med at the time, and I had friends in my ballet class, I danced all through college and everything. And there were a few that were super, super bendy. And but I had no clue what that meant. It wasn't until many, many, many years later that I became, knowledgeable, but it had impacted me for decades before then. So
it almost is like you don't know it unless it's something you have to deal with personally, and it's one of those things out of sight, out of mind for most people, including myself in that. And I think that's why we're here today, right? Is to make sure that you are aware as an educator, as a parent, as a student, that these things do happen and they do exist, and make sure that you're aware, because it could impact, you might be thinking something about another dancer and not realize that they're having this struggle that you know nothing about. So it's just getting the education, getting the resources so that we can all be kinder, compassionate, and provide safer spaces for all of our dancers, which is why we're here, right? So with that, let's get into the first segment, Melissa.
Yes, absolutely. We like to start with the basics here because we have such a wide range of viewers from many different parts of the dance world. And I mean, just like I said, I've never thought about this issue as a dance educator. So I want to start with the basics for myself. So Dr. Bluestein, what is hypermobility?
So hypermobility, excuse me, means that at least one joint has greater than average range of motion. And it is a descriptor, not a diagnosis. And a dancer could have one hypermobile joint. They could have many hypermobile joints, or maybe they were hypermobile in the past, but they're not anymore. One of the things that's really tricky is people can be what's called pre-symptomatic, meaning that they don't have symptoms yet, but they may develop them in the future. And that is why this is so important, so that we can identify dancers as early as possible, so that maybe we can make it so that in the future, they don't develop the degree of problems that a lot of people do experience. So if we can be preventative, that can be very, very helpful.
Is it common to see this in younger dancers, or is there an age when this typically becomes more prevalent?
So we are more hypermobile when we're young. So if you look at babies, babies and young kids, they're just like they can be all over the place, right? So it is definitely important to take into account when you're assessing someone for hypermobility, their age and gender affects it, all kinds of things like temperature. If you're doing measurements later in the day versus earlier in the day, if someone's warmed up, injuries can affect it, race, like a whole bunch of different factors can impact hypermobility. But one of the really, really big things is the onset of menstrual cycles.
Really?
Yeah. When a young woman starts her period and the cycling of hormones can have a significant impact on joint laxity. And so it's really important to identify before the onset of periods who these dancers in particular are affected, so that when they get their period and if they start developing problems, we can be like right on it and really address it right away and prevent the downstream effects that sometimes can happen when things go under-recognized.
Yeah. So how does double jointed fit the term double jointed or being double in the studio? Is that the same as having hypermobility?
So there are some terms that seem to be used kind of interchangeably, and double jointed is one of those that I think a lot of people use, and it can refer to a few different things that they're not exactly the same. I think of someone being double jointed as having enough joint mobility that they're actually able to do like some party tricks with their joints, which I wish I knew when I was a teenager, that popping your hip in and out, you're not really, I definitely wasn't really dislocating it. I was actually doing something called snapping hip, but I would do it for tricks at parties. I would show off to my friends. And
I was going to say, we all kind of have that one person that's like, do that thing with your body, that people can do that. And it's probably not good.
Yeah.
We're all doing that.
Right. So if you have party tricks or if you have circus tricks, I tell people, you can definitely do those and record them so that you have them. Or if I'm doing a one-on-one session, I record them at the first session. And then I say, unless you're in the circus, No more
Don't do
circus.
this.
Yeah.
That's
If
so
you're
good.
in the circus and you're being paid, and actually for that matter, so that's working at your end range, right? So there will be times that you want to work at your end range, but you're not going to work at your end range all the time, because even if you are in the circus, even if you are a dancer and you need to be accessing those end ranges, you don't want to be accessing those all the time, because that can be hard on the body.
Yeah, and we're going to talk about that in a minute. But as we're on the topic of interchangeability, so what about hypermobility versus hypermobility syndrome or hypermobility disorder? Are those interchangeable, or are they two different things?
Right, definitely two different things. So
Okay.
hypermobility means that you have at least one joint that has greater than average range of motion, and there's different subtypes. In 2017, the International Consortium defined different subtypes. So it could be, and it depends on where the joints are, and is it current or historical. And so there's different types of hypermobility.
Okay.
And then when we talk about hypermobility syndromes or hypermobility disorders, that means that a person has hypermobility and they have symptoms that are likely attributed or likely related to their hypermobility, not just any old symptom. You know, if you have hypermobility and you have high blood pressure, for example, and nothing else, like we would, you know, we wouldn't say that those two were related. If you have hypermobility and you have pain or anxiety or, you know, ADHD or some of these other things that tend to occur more commonly, dizziness, you know, lightheadedness when you stand up, difficulty with temperature change and things like this, then that's starting to look more like you have a hypermobility syndrome or hypermobility disorder.
Got it. Got it. Okay, thank you for that. So for all of you just joining, I'm Bree with Paula, and here with my co-host Melissa McDaniel. We're chatting with Dr. Linda Bluestein today about how can we help our students that are struggling with hypermobility and or hypermobility disorders, because a lot of it goes unseen, sometimes undiagnosed. People don't know enough about it. We're admittedly saying we don't know a lot about it. So Dr. Bluestein is here for that reason. So if you have comments or questions as we continue this conversation, please put those in the comment box or the chat, whether you're on Facebook, here on Zoom, or on Instagram. We'd love to hear from you. We do have a comment on Instagram right now. Healing with Heads says, my mom has no medical knowledge, but always stopped doing any party tricks. She didn't know why, but she knew to stop me doing them all the time. Thank you for this session. Thank you for watching. Thank you so much for sharing your experience, and it means a lot to have you here. Thank you so much. We're going to go on to the second segment. So, you know, are these hypermobility disorders hereditary? Or do they develop over time because of outside environmental influences? Like, what is the cause of these hypermobility disorders?
The short answer is yes and yes, but the longer answer is there are a whole host of things that can affect hypermobility. So you can have a genetic reason why you're hypermobile. There are a collection of disorders that fall into the category of hereditary disorders of connective tissue, abbreviated as HDCT. But there are also hundreds of non-genetic reasons why a person could be hypermobile. And so we also want to be thinking about, you know, could a person have a genetic condition, but because of environmental factors, it expresses itself differently than it does in, for example, the older generations, who oftentimes when they're in my office and they say, I don't get it. Why is my daughter so impacted by this? And yet I'm quite sure she inherited it from me, and I'm not that bad off. And I inherited it probably from my mother, who is even less, you know, impacted. So we definitely feel like it's a combination of factors in many, many cases.
Is it like I struggle with autoimmune disorders. I have lupus, but that was incredibly hard for them to diagnose. Thought it was rheumatoid arthritis, thought it was all these things. Is it similar to that, where, you know, it could be any number of things that they're seeing, and it takes a specialist, somebody like you who knows what they're doing, obviously, to diagnose this properly? What are the symptoms that we look for in somebody who particularly has a hypermobility disorder?
Sure. So there are things that can affect the musculoskeletal system. So those would be, injured more easily, takes longer to heal, chronic pain, maybe being super sensitive to even light touch feels painful, or something that's called allodynia, or hyperalgesia, which means that something that normally is painful, like a blood pressure cuff going up on your arm, yeah, that's normally uncomfortable, but now it's excruciatingly painful. And even when I was working as an anesthesiologist in the operating room, I didn't understand that. So if I had a patient and we would, be checking the blood pressure and they're like screaming, I didn't even at that time understand. These things are very, complex and nuanced, but so there's things that happen in the musculoskeletal system. There are also things that can happen in the skin, where you can have skin that tears more easily, skin that's extra stretchy. Now I'm talking about the genetic ones, things that scars don't heal well, and scars break down, skin breaks down in the healing process. And then there's things that can also happen with other weak tissues. So maybe you have hernias, maybe you have something called pelvic organ prolapse. And again, your average doctor isn't going to put this together. You come in and you've got, you've got recurrent abdominal hernias, you have chronic pain, you have, you're dizzy when you stand up. That's one of the comorbidities. You get dizzy when you stand up because your autonomic nervous system doesn't function properly. And they look at you like, I don't know, that's a heck of a lot of stuff going on in one body. If they're not familiar with it, unfortunately, they tend to, we tend to label people and blame them if we don't have the answer. And it's a terrible thing that's happening in medicine right now. But there's a variety of reasons why I think that happens. But if we don't understand things and we can't see it, we can all understand a broken bone. We can see the x-ray, especially if the bone's sticking out through the skin. We get that it's painful. But if we can't see it, we have a hard time sometimes being empathetic to it or understand.
Oh gosh, that could that could apply to a number of topics. So that could lead us down a road I don't even think we have time to go on today. But yes, that is so true with everything in life, right?
Dr. Bluestein, we have oh, go ahead, Bree.
No, people want that, like, prove it, and it's not that simple sometimes.
Yeah, we have a comment on Instagram. Our wonderful friend Christina Michaels over at Queer Dance Project wanted you to explain environmental factors a little bit more, Dr. Bluestein. Like, what are some environmental factors?
Sure. So depending on how a dancer's nutrition is, can impact things a lot. And this can be a vicious cycle. So say the dancer is, trying to, continue with their dance, but they've had an injury. And so they have now their immune system gets activated, because when we have tissue damage, that activates the immune system. And that can cause the body to be less tolerant to foods. So we can, and I'm oversimplifying this, of course, but so then the dancer can end up, this kind of can be comorbid with disordered eating, because now all of a sudden when you go to eat, you don't feel well, you get nausea after eating, you get super full after eating, maybe even you vomit, you have abdominal pain. And so you become intolerant of certain foods. Well, now your body is lacking the nutrients that it needs in order to build strong tissues. Our bodies need so many nutrients and so many cofactors, and we need, there's the macronutrients, there's protein, fat, and carbohydrates, but we also need micronutrients. We need all the B vitamins, and we need, magnesium and zinc and all of these incredibly important things. And we get that from our food. But as dancers, we really struggle with this because, so many of us have a history of disordered eating, or we're given messages of, there's no such thing as too skinny. So, that can go hand in hand with the hypermobility disorders, because those can impact the gut. And so then that kind of can make it very, very complicated to tease out how much of this dancer's picture is related to gut problems, how much is related to messages they're getting in the studio, and how can we help them, be in a better place.
Thank you for that. So just going off the beaten path here for a minute, are there specific vitamins or nutrients that you recommend to your patients that do struggle with hypermobility? Is there a certain vitamin regimen that you recommend that they follow?
So I very, very commonly recommend vitamins and supplements to my patients.
Yeah.
I do an initial assessment and determine what their biggest problems are, because everybody is so different. And there's a saying in the MCAS world, mast cell activation syndrome: if you've seen one MCAS patient, you've seen one MCAS patient.
Yeah.
Because each person is so incredibly unique.
Mhm.
And my dear, dear friend, Kristen Koskinen, who I'm sure you both also know,
Yes, we love Kristen.
she says all the time, N equals 1, which is another way of saying, each person is
Right.
incredibly unique.
Mhm.
So it varies depending on their clinical picture. Are they somebody that has diarrhea and is going, to the bathroom 8
Yeah.
times a day? Or are they incredibly constipated and they're going once every 8 days?
Yeah.
Mhm.
Because that will vary the recommendations dramatically.
Yeah. Thank you. Thank you
Mhm.
very much. We do have a couple more comments and questions here, Melissa. A medicated visual says, that's the way my doctors are looking at me. I know it's a lot going on inside my body. It's really frustrating. Yeah, thank you for sharing that. And I'm
Yeah.
sorry you're going through that. We have to get to a place where we're more aware and in tune and empathetic for people that are struggling with this. I think it's really underestimated right now. And I'm thinking, Melissa, I don't even know about you, but like I'm thinking back to my experiences, because I've been a director for a long time. A lot of different students have come in and out of my doors, and I'm thinking back going, I wonder if when this
Mhm.
child was saying in pain all the time and
Right.
always sitting out and always injured, now I'm going, I wish I would have known this, because perhaps that child was struggling with hypermobility
Yeah.
issues.
Yeah, I was gonna say that, like, when she was saying, the intense pain that may not be intense pain for every other
Yeah.
student, and
Like
that
you're
one
looking at
child
it going, there's
going,
nothing
oh,
wrong. What's wrong with you?
right. Yeah,
Yeah.
that's definitely, I was gonna ask about that, because there's been so many times where I've been like, I mean, it's really not that bad. Like, everyone else is fill
Or
in
they've been
blank.
to the doctor 80,000 times and the
Mhm.
doctor can't find anything wrong, but then the child is still complaining, and you're like, we've checked all the boxes. What's going on? And maybe
Right.
I have one student in my head right now in particular, and now I'm like, I wonder if that's what it was or what it is.
Right. Right. Yeah. Yeah.
And the degree of I just want to say the degree of hypermobility is not necessarily, an indicator. I mean, there's a lot of
Okay. Yeah.
there's a lot of things that we need to assess, because it's also how the bones are aligned and how the whole body is built. And so the assessment is not simple or straightforward, which is another reason why there is so much difficulty in, if you think about, most of these people are presenting to their primary care doctor. At least they're presenting there first.
Right.
And we need more awareness within primary care doctors for sure. But they have to know about so many things. They need to know how to treat, UTIs and pneumonia and, wounds and, just so many things. So this gets very nuanced very quickly. So they need to know who to refer out to, really.
So we talked earlier about the party tricks, jokingly, the party tricks and the circus tricks and all of that, and don't do it. But oftentimes I want to bring that back to the studio, and what we see at competitions, year in and year out, is those kids that are super hyper flexible, doing all of these insane things that bodies are not meant to do, right? In general. And we see them on stage and we see it almost celebrated in a way and rewarded with the scoring and with placement in dances and choreography, and how they're revered by their teammates or other dancers around them. And so what are the risks in celebrating that? What are your thoughts on it, I guess? So what are your thoughts, and are there risks, or is it okay to do that? And where do you stand on that?
So I view this very much like the football players in the NFL. They know that there's a risk of head injury, a risk of concussion, a risk of very serious brain injury, right? But they're choosing, for, I'm sure it's different reasons for different people, but they're choosing to compete in that sport. If you are an adult, then my goal is to give people information so that they can make their own choice about whether or not they want to participate in that activity. Is it worth the potential risk to do these certain things? And I wish we could say, with definitive scientific proof, if you do ABC, then CDE will happen. But of course, it's more vague than that. We don't know exactly for sure. But I will tell you that I communicate a lot with ex-professional dancers that will reach out to me and say, oh my gosh, I wish you were around when I was dancing.
Yeah.
And, I now have gotten a diagnosis of EDS, which is Ehlers-Danlos syndrome, which is one of the most common types of hereditary disorders of connective tissue. And they will say, I wish I had known then. I always ask, what do you wish you had known back then?
Yeah.
Because that's such valuable information. And then of course, when children are young, it's their parents that are, more responsible. So I think it's important to educate parents and to educate teens and, adults so that they know, so that they can make more informed decisions about what the potential implications are from doing these different activities. So I'll give you one example. I had a dancer in my office who was doing several different types of dance, and she was already having a lot of problems. She had had several surgeries, and she was getting ready to go up on point. She was like 11 or 12, and she was getting ready to go up on point, and she was so excited about it. And I was chatting with her, and she was there because she was having pain, like a lot of pain. And I said, like, what are your goals with dance? And it turned out she loved modern dance much more than ballet.
Yeah.
And I was like, it's your decision, not mine, but ultimately, do you think that going up on point, is that something that you really want to do? Because that potentially could impact, she'd already had multiple ankle surgeries.
Yeah.
So I think that, it's individual. Each person needs to decide and needs to think about, what is it that where am I potentially going with my dance career? And where am I potentially going with this body that I have in this set of potential problems?
Yeah,
Risk
absolutely.
assessment. I mean, that's really what it boils down to.
100%.
Right. And understanding your body versus someone else's body, and
Yep.
stay in your lane. I think that's the proper term. Stay in your lane. Know what you can do and do that very, very well. We have a comment here on Instagram from lifechanges.growings. I have a doctor who is focused on diagnosing me with ALS and not paying attention to my hypermobility at all. That is, I think that just lends itself, like you said, Dr. Bluestein, to there's just not enough education out there, especially probably on the gatekeeper level,
You need to visit Hypermobility MD and book a consult with Dr. Bluestein is what that sounds like.
Well, that's
right.
I'm immediately thinking, whoa, ALS. That's for those that don't know. I mean, that's a progressive neuromuscular condition. And so that's a very, very important distinction. And there are, part of making the diagnoses of these conditions involves ruling out other causes of hypermobility. So again, there are people that are probably inappropriately labeled in either direction, right?
Thank you.
Is it healing with HEEDS? I was born a low tone baby, and I got my diagnosis at 26 years old, despite having symptoms all my life. Oh my gosh, 26 years it took. Just that is why we have people like Dr. Bluestein out there to help lead the charge on educating people about hypermobility and not having people wait 26 years to understand what's going on in their body. Thank you so much, both of you, for sharing your stories with us. We talked a lot last season about the importance of rest and recovery. And we had a number of guests join us throughout the season to talk about dancing over breaks, not dancing through break times, giving the opportunity for rest and recovery. How important is rest and recovery to keeping dancers with hypermobility syndromes healthy?
Oh my gosh, so important. And each dancer needs to learn to listen to their body and with the right type of ear and with a curious mindset, not an anxious mindset, if you possibly can. And so, it's important to know that overuse injuries are much more common in dancers than traumatic injuries. So traumatic injuries happen suddenly. You sprain your ankle after you did a grand jeté and landed on your ankle wrong. That's much, much less common than overuse injuries. So this nagging thing that just kind of doesn't seem to go away, and you can't pinpoint exactly when it started. And it's important to keep track, though. Is it getting worse? Does it seem like it's getting better? What does it respond to? And rest is so, so important, especially because as we get older, our bodies are not able to generate new cells as quickly as when we're younger. So part of why we can be hypermobile and not feel bad when we're younger is because the repair damage cycle is more in our favor. And as we get older, we're still accumulating damage to our bodies, but we're not able to repair cells as quickly as we could when we're younger. So yeah, rest is extremely important. I also liken it to a brick wall. If we have an injury and some bricks have fallen off of the wall, and we don't take the time to put the bricks back on more quickly than we're taking them off, we're never going to get better. So we need the nutrition, literally the building blocks. We need to be putting those on at least as fast as we're taking them down.
Thank you. Wow.
Absolutely. Last season, going back to last season, we also had Carlos Caraballo on the show, and he helped us understand the benefits of cross training, and understanding how cross training can help dancers in general. Is cross training something that you can do proactively to help keep hypermobility students safe and injury free?
Oh my gosh, absolutely. So it's important to understand the distinction between hypermobility and joint instability. So hypermobility refers to range of motion. Okay, so that refers to range of motion, and joint instability has to do with the joint being in proper alignment. So shoulders are a joint that is much more commonly unstable. And so the head of the humerus is supposed to sit in a proper way in the shoulder, but if it's not, then that would be joint instability. If you build muscle around that area, and particularly the deep stabilizing muscles. So for the shoulder, it would be the rotator cuff, for example. Those muscles we can't assume that they're just automatically going to be working properly. We can use different muscles to move our arm, but that doesn't mean that they're the right muscles to use. That doesn't mean that we're moving in the right way. So if we do cross training and we train those deep stabilizing muscles, that can help get the joint in proper alignment and stay there more easily. And that will help to minimize the micro trauma and macro trauma that can happen with the hypermobility.
Thank you. So do you think overall, because I think that was the consensus last season, right? Is that at the end of the day, I think as educators, when we're scheduling these kids, we need to focus, not obviously base technique is important, but I think, in terms of over scheduling technique, I think we need to resist the urge to add more technique classes, add more cross training, add more mental health exercises and mindset activities for our students. And I think we'll find that we're going to have a whole happy, healthy dancer inside out, head to toe, which is what we're all about, right?
Yes.
Yeah. So Melissa, wait, you have another question before I go into my question.
I didn't have a question. I was drinking water. Yes.
Okay. So, a lot of parents probably don't understand that their child may be at a greater risk for hypermobility disorder, especially, if my parents had no idea what those things were. They're just, you gloss over it, take care of yourself, heal the ailment at the time or at the moment and move on. Right. But when we're, we went off Instagram. What happened?
I know. I'm coming back on. Y'all wait for my invitation.
Right.
I don't know what happened.
Okay. So, when, are there things that parents should be doing at home, exercises, protocols, if their child is experiencing any of these symptoms, if their child has been diagnosed with any sort of hypermobility issue? What are the protocols, the exercises that they could be doing at home for preventative care, and giving their child the best shot at being healthy and comfortable and safe?
So the biggest thing that parents can do is support their child, validate their experience. And because sometimes, parents don't understand, they don't believe, well, then that causes us to doubt ourselves. And so that, I always try to think of what is the intervention that we can have that's the least invasive, but is going to have the biggest impact. And being there for your child is so incredibly important. So understanding that, what they're experiencing is their experience, and supporting them through that, and seeking the expertise of yes, whether it's a Pilates instructor or a physical therapist or a gyrotonics instructor, somebody that can help them with the cross training. Somebody who has dance medicine training is hugely important. So go to the Doctors for Dancers website. go to the IADM's website, check out Dance Medica, all of these different places that are going to give you a list of providers that have dance medicine education and can support your dancer is going to be very beneficial.
Well, and like Leah Bueno, who's the Pilates dancer, she is actually a movement specialist that actually works with dancers to make sure, she's not a doctor, it's not in that realm, but she does work with dancers in rehabbing from injuries or people who are struggling with constant issues to make sure that those issues do not continue throughout their life. And so our friend Leah Bueno joined us last season, and again, check her out as well at pilatesdancer.com, I believe it is. So yeah, but thank you for that, because I think, and as educators too, I think, don't you think we need to maybe challenge educators to think about this a little bit more in terms of how they can be proactively helping their students with these issues?
Oh, absolutely. And I think that parents need to know where to send their kids, right?
Yeah.
So I love it when I get invited into a studio and to talk to the dance educators and the kids, because then I know that this dance educator really, really cares about those kids. I've had dance educators pay for me to come in and do a one-on-one assessment with their kid. They pay, not the parents.
Well, I was going to ask, do you do that? Because do you consult with, you do obviously consult with studios and teams. That's not a bad thing to have, because in this day and age, especially with 2020 and last year, we don't like to speak of it, but what we learned from that time is that a lot of things can be done virtually, right? So how are you able to navigate that and handle that relationship virtually if you need to?
Right. So I can do it virtually. If I can do it in person, it's even better, because then I often will have somebody come up and we'll demonstrate different things. And I make observations, right? I'll be talking and I'll look around the room. Of course, I can still see them even if we're like on Zoom like this, but then they're small, right? So I can't see them as big. But they'll be leaning on hyperextended elbows, and they'll be doing things with their bodies. Like as I'm talking, I'm observing them, and I'm like, oh my gosh. And I see their eyes get bigger and bigger and bigger. And by the end, they're like, oh my gosh, you just described me. I mean, the light bulbs that go off are really, and of course the dance teacher often themselves is impacted by these things, but had no clue. So they're often, by the end, they're like, oh my gosh, I had never thought about all those things before.
Yeah.
And why would you? Why would you? That's the other thing, is I think we need to show more compassion to our dance educators, because, we're asking them to be responsible for a lot of things.
Yeah.
And for me, growing up, my Diane Lauritsen is the studio that I grew up in, and she is a second mom to me. I love her. She is just amazing. She did a reading at my wedding. I mean, it's just, you get very close to these people because they, you spend a lot of time with your coaches and teachers. Yeah.
Yeah, and it really is true. We really do ask them to be, as an educator, a dance educator specifically, to be a jack of all trades. And I don't know that that's fair, because they're not. Melissa, I'm having trouble getting back in. I don't know.
I cannot get back on IG.
I don't know
at all.
Instagram, if you're listening, get it together. It's been a hard week. It's been a hard week. Instagram, get it together. But no, I think, it is unfair, because we know there's no certification to become a dance teacher. There's no degree, you can get a degree in dance, but to be a dance educator, have a studio business, there's no standardization or certification that comes with that. And to ask them to deal with mental health issues and basically be a doctor when they're not one is not fair. But I think what I would challenge studio directors and educators and owners to do is find those resources in your community, find virtual resources, so that when you do have these issues pop up, because you inevitably will, you can present this list of resources to them, to your families and to your students, and say, here you go. I'm not an expert, but this is where you need to look. And I think that is our responsibility as an educator. Do you agree with that?
I agree 100%. That's absolutely right. You can't possibly know everything. And Melissa said it at the beginning. One of the most important things for all of us is knowing how to stay in our lane. I know that I don't know, I know like this, and so I try to stay in my lane as best I possibly can. So yes, dance educators, they know how to teach dance, and I know how to teach about certain things and work one-on-one with people or whatever. But yeah, absolutely. And I think having resources for all of those things, whether it's you're concerned about a dancer and an eating disorder, or you're concerned about a dancer and some things that they're going through with their mood, yes, I think it would be fabulous for dance educators to have those resources and be able to connect dance parents, and point them in the right direction.
Yeah, 100%. So thank you for all of that wonderful information. Hopefully this is helpful for people out there. Let us know if you guys are, if you all are benefiting from this information, if you have any additional questions, but we like to give homework every week. So Melissa, you have our homework for this week
Yes,
on Beyond the Steps.
absolutely. So the first thing is, Dr. Bluestein, we would love to know what is one action that you want our viewers or listeners to take between now and next week to make progress in this area.
One action. So this is going to sound very self-serving, but if you go to my website,
I love it.
Nope, love it.
I have every podcast interview that well, not everyone that I've done, but there's a lot of podcast interviews on there that I have done. There's a link to all of the podcast interviews that Bendy Bodies has done, which I co-host with Jennifer Milner. There's a link to all of those episodes. There's some blog posts. There's links to other resources that are, I feel that are beneficial. There's a lot of information out there. It's important to make sure that you are taking in the information that you need, but not overdosing either, because that can feed into the anxiety. So sometimes, and Facebook is an amazing resource. Oh my gosh, it's fantastic. But sometimes if you get in a Facebook group that is, for example, about certain kind of scarier things that can happen, like with hypermobility, and I'm a very suggestible person. Everyone's different in terms of that, but you can start to sometimes imagine things that are not there and are not a problem for you. So it's important to remember too that, like in a Facebook group, for example, that's a self-selected audience of people who, who are spending more time on there. So you want to remember that doesn't mean that is your exact experience, because there's going to be a lot of other people who they're not on there because they're out doing other things. So those are just important things to keep in mind.
Yeah, thank you.
Thank you so much.
Yeah, go ahead, Melissa.
Thank you so much. So you have your homework. Visit hypermobilitymd.com. I put it in the chat over there on Facebook. And so make sure you do that between now. You got 7 days to go and get some factual resources from Dr. Bluestein there on the website. Also, taking the module in the STEPS initiative, it is still up. It is still there for you. It is still a free, FREE, free resource that you can find on the Apollo Performance website. Bree is going to put that there in the chat for you to be able to access that.
I would, but Facebook now has kicked us off as well. So
wow,
I think it's Facebook and Instagram are having an issue,
having a field day. Okay, it's no
but
problem.
I will link it after this video, after we get the recording up. We'll link it there.
Perfect. And then YPAD certification is also certifications. They have multiple certifications are also available to you. They are doing some youth protection advocates. What's
Youth
the
Protection Advocates in Dance.
In dance. I always forget because of the in dance. I'm like, what is the D? Youth Protection Advocates in Dance. Doing great work out there. Has a number of courses, and Apollo is providing you with a 25% off code, Apollo25. So visit their website, ypadnow.com, and take advantage of some of those courses that are also out there.
And I want to mention again, doctorsfordancers.com is a great resource to find specialists in your area. Our friends at, YPAD, of course, ypad.org. And then the Bridge Dance Project .com. Make sure you get familiar with all of these organizations, because they are doing great work. And they're providing education and resources, and oftentimes free information that will help you kind of piece things together on your own, or lead you to the correct to the correct help for your dancer or yourself. So make sure that you're familiar. I always take for granted, because they're such a big part of our ecosystem at Apollo, I take for granted that everybody knows that those things exist. And I just had a conversation last week that reminded me, oh no, there's
Right.
definitely people that need to be informed still. So we need to make sure we're shouting out from the rooftops that these the amazing work that's being done in advanced medicine and science.
Yes, absolutely. And Dr. Bluestein already gave us a resource. Her website is there and available to us. Are there any other websites other than the ones we've named, Doctors for Dancers, Bridge Dance Project, all of those that you would recommend, Dr. Bluestein?
So for people who want more specific information about EDS, there are several, EDS meaning Ehlers-Danlos syndromes. There are several websites that are useful. Ehlers-Danlos.com is for the EDS Society. There is something called the EDS Toolkit, which is geared more towards primary care providers, but they have very well organized resources there as well. And then there are a few books that are very helpful that I have linked on my website on the media page.
Great.
Right.
Awesome.
Perfect.
Thank you. And so you all have your homework. It's Friday. There's nothing better than going into a weekend with homework from Beyond the Steps. Get it done. Dr. Bluestein, thank you so much for being here with
Yes,
us today,
thank
and
you.
for just taking the time to educate all of us and share, your unbelievable wealth of knowledge with all of us. We appreciate you so much.
Well, thank you so much for having me. It was fun chatting with both of you.
Yeah, I always love when we can catch up. So thank you.
Thank you.
And we're going to be back here next week. I'm going to be back here next week.
Yes.
Melissa's jetting off to Cancun and leaving me here.
Woo!
But I will be back next week on Friday, October 15th at 2 p.m. Eastern. We're going to be talking to T. Doman, who is a PT, and she's also the creator of the Fit Chick blog, why it's important to incorporate breath work into training for our dancers. So we're talking a lot this season about cross training, mindset skills, different things outside of technique that can really help our dancers to be more well-rounded. And again, happy, healthy, whole dancers from the inside out, head to toe, is really what the goal is for us. When we know better, we do better. So that is what our mission is here at the show. But join us next week. I can't wait for this conversation. It's going to be another good one. We'll miss Melissa as always. But until then, we hope you continue your journey beyond the steps, and everybody have a wonderful weekend.
Bye.
Bye.
Bye, all.